This is Dr. Gregory Jenkins back here at KHTS. I'm here with Dr. Judith Curts. And in this segment, we're going to talk for a few minutes about the actual physiology of lovemaking. We're going to talk about erection and the testicles, the vulva, the vagina, all those parts down there that are involved in lovemaking.
And give us pleasure.
That's right, pleasureful.
Hopefully.
So, because Dr. Curts, we talked earlier about what makes people like each other, the cathexis. The attraction, yes. The look, the smell, the way they act.
Yes.
Well, after all that, the physiology of the body starts to come in.
Yes.
And usually what happens, the arousal can be either physical or psychological. Some people can be aroused by looking at a picture.
Correct.
Some people...
Mainly men.
Really? Is that right?
Oh, but some women can too.
And then, but the arousal can be also actually by touch.
Yes.
So I think probably that's the more common one, you think? I mean, kissing is touching.
Kissing is touching, yeah. Even touching an arm when you're talking to someone. Yes, yes.
So once you have that arousal happen, after you have either the way they look, the way they talk, the way they smell, the way they touch your shoulder, or if they start touching your genitals, then the arousal starts to begin. And usually what happens, the first thing is there is vasodilation. I'm going to go back and forth between the men and the women. For the man, they have vasodilation, and that means increasing the of the arteries and veins.
Yes.
And then you get an erection because the veins will close down, so the blood continues to be pumped into the penis, but it does not leave. And that's what causes the erection. Now, in women, what happens is that they also get increase in size. They'll get an enlargement of the clitoris, the vulva, nipples, the vaginal walls will all become more engorged and red and swollen.
And doesn't the vaginal canal also elongate?
It changes, and the uterus tips. And the reason it tips is so that it can accept the sperm to get pregnant.
For procreation.
Not everybody wants to get pregnant, but that's what happens.
Yes.
So for the men, as they continue to become aroused, the testicles actually rise. Pull back up closer to you. They change color
because they're scared. No.
Maybe it's cold outside.
I don't know.
I don't think it's cold this time.
Okay.
But the testicles rise up because that helps push the prostate, and then the seminal fluid comes out of the prostate to mix with the sperm for the ejaculation. So for men, what happens? From women also, what happens? Like we talked earlier, that the vagina changes shape, and so they can easily accept the sperm. So after we have these few things, as you continue to have engorgement of the penis, and the intercourse happens, the friction causes, because I forgot to tell you that the head of the penis, the corona or the head, becomes bigger, and you'll find some enjoyment out of that. And then as you continue to have intercourse, your penis will eventually reach an orgasm. And for the woman, the same thing happens, is that they continue to find the lubrication will increase, and they become more and more aroused, and they'll have an orgasm also.
Sounds really simple. Why do people have problems?
I think if you miss one step, you're in big trouble.
Well, that's...
If you write to the store, we'll send these notes to you.
Masters and Johnson had the 4 phases of the sexual response system, which is, the first is excitement, like, ooh, I'm really excited about this, I'm attracted. And then the second that you talked about was plateau, where you're having intercourse, or you're touching, feeling, and that feels so amazing, it gets better and better and better. And then the orgasm is the third stage, and then the fourth is the resolution, and that means it's over. And sometimes it can be very sweet when it's over, hopefully, or sometimes it's just very disappointing.
Thank God that's over.
Yeah, or very disappointing.
Thank God, I can't wait to see that guy again.
Like, ugh, that was too fast, I'm so embarrassed. Everybody goes through that at some time, certainly.
Yeah. How do do you train couples to try to have an orgasm at the same time?
I really don't. Some couples have come to me thinking that that's important. They want to experience that together. Personally, I talk to them and say, isn't it fun to enjoy the other person's orgasm and to be present and alert and conscious when they're having it? Because when you're both having an orgasm at the same time, can be good. But it's more difficult. It can happen. I don't think it's that important. Used to be on the TV shows. Everybody had the orgasm at the same time, and all was amazing.
Well, I've had patients tell me that they rather have an orgasm together with the partner because if one just wants to have sex because the other one wants to have it, they're just happy to do it. They're happy to, okay, you want to have sex? Let's have sex.
Sure.
I'm not going to climax, but I don't care. I'm just happy that you're getting happy.
Absolutely. And I think couples need to talk about that, saying, you want to, that's fine. I don't have the need for an orgasm right now. I just don't. But I want to give you pleasure. And that's one of the myths about female sexuality, is that women don't need to have an orgasm all the time to enjoy sex. Women can enjoy sex without that. The journey for them is pretty darn good.
Wow. I'm learning a lot about psychology and cathexis today. I'm so glad I learned the word cathexis. Have I used it more than 5 times?
You're going to use that a lot in your lifetime.
I tell you, I'm looking it up, But so then the other thing about for couples, for people having sex, is that there's a thing called a refractory period.
Yes.
And that is how long for men, how long from one orgasm to going back to starting all over again.
Yes.
The younger you are, the sooner it happens. For women, they don't really have a very long refractory period, so they can have sex over and over again as much as they want without waiting.
They can do that because the vaginal walls are engorged, and they can, have pleasure. Now, they may be tired. They may need a few minutes to kind of gather themselves, but yes, they can. But men do need that refractory period, and there's a big difference between a 19-year-old, a 50-year-old, and a 75-year-old. Big difference, isn't there?
Oh, huge.
You're the doctor.
Huge amount, because what happens is that in men, the testosterone levels fall as we get to male menopause. Some people call it manopause. And also there's a change in the estrogen and the cortisol in our body, which changes that also. And I wonder if there's some new product that boosts that, over-the-counter product. Maybe there's a lady coming up next week. We can ask her about that.
That would be great.
Yeah.
That would be great. And with women, of course, after menopause, there's vaginal dryness. So I think you've got to talk to your partner and saying, hey, we need an additional something here. We need some lubrication. I need more time. And women take a minimum of 20 minutes to become aroused. Minimum 20 minutes.
Do they have little pink timers for that?
That would be good to just sit a little timer down.
Little hour thing, you turn it upside down, and 20-minute thing, you turn it upside down, and when it buzzes, it's time.
I think that would be very helpful because, there are some men that think 2 minutes, that's good. She's wet, so that means she's ready, but she's not a dipstick, like checking the oil in the car. She really has to be able to feel that and to be ready. And let me tell you about the clitoris a little bit.
Okay.
A lot of people think it's the size of a pea or just very small. Not really. It's about 4 inches long. It's internal, and it's shaped like a wishbone. So what we think is the little pea that gets engorged is actually the tip of the wishbone, and the sides go down the vaginal canal, so that makes it pretty exciting. But another caution, only 30% of women can have an orgasm just with intercourse. So the majority cannot and need so much more stimulation, clitoral stimulation, talk, touch, all kinds of things. And, I think it's up to the partners to tell each other what excites them.
Okay. So, it's, when we're being developed, we're still a fetus, and we don't know whether they're going to be a boy or a girl.
Right.
Eventually, the genes say you're a boy, you're a girl. So we have the same embryonic tissues. So if you look at it in a microscope, a prostate and a uterus, the tissues are very similar.
Oh, I didn't know that.
Yeah. So the testicles and the ovaries are very similar because they're really the same thing.
Yes.
They can't, and when we decide to be a boy, the testicles, or whatever they were at the time, they come out and go into the scrotum. The scrotum is the same tissue as the labia.
Yes.
So they're called homologs. Mm-hmm. And you're talking about the wishbone, the same with the men. The penis is the top of the wishbone, and it goes down to where it hooks on. But then it also goes down, upside down wishbone, I think. And if you feel it, it goes down towards the rectum along the inner part of your legs. So you only can notice that actually when you're having an erection, but it's the same type of tissue as the women have, the clitoris.
So we seem to be so different, and yet we're so very similar in many ways.
That's right.
In experiencing sexuality and orgasm. But I think where we're different sometimes is psychologically.
I would think we're very different psychologically.
Yes, yes.
I think so.
And a lot of it, too, I think, is culturally defined. We get told a lot of things, and a lot of things that really aren't true. So, we have to get the correct information. And, before the show, it always says cover the children's ears. I think 12 or older, this would be a great show, because I think children in sex education really don't get the information. And I think this would be a great show. So parents, if you hear it and you want to let your adolescent later listen to it, it's up to you, with your guidance, might be a good idea.
Yeah, I think I remember having sex ed, for 1 hour in the 5th grade. And it was more about giggling.
Yes, yeah.
Laughing about what happened. And the women after that, the girls, I guess at that time, they went into a separate, or the boys all left, I guess, and the girls stayed for another hour to learn about menstruation.
Oh, yeah, yeah.
So, we were all giggling that they're in there and what's going on, put our ear to the door trying to hear. So it was, I didn't learn anything from that meeting,
Oh, of course. And generally, the PE coaches were the ones that had to teach.
The health coach, yeah.
Right. And many times, they didn't know what they were talking about, and they were kind of embarrassed about it, so they're just reading from a pamphlet or something. So, I asked many people, well, where did you learn about sex? Well, from my friends. I said, oh, yeah, and they knew everything, didn't they? You learn from your friends. Well, this girl did this, or, so therefore all women should be that way. So it's kind of sad. We really haven't had good sex education. And just recently we had that we taught in the schools. We taught not to have sex, not to be sexual at all.
That's right. That's something the church is supposed to teach you.
Yes, yes. And that's really not true. People are sexual. We're sexual human beings, and I think education is power, and education is knowledge, and it will keep you safer than the lack of education, because then you just hear anything that somebody thinks. So I think the better educated we are and the better we educate our children, the better off they're going to be, and then they're armed with all of the correct information. So even if you're shy, get somebody else to help you, and maybe the kids are going to giggle anyway, because it is kind of funny.
Yeah, I think the kids are just uncomfortable with the topic.
Sure. And
maybe they should wait a few years before they talk to them about it. So at 5 in the 5th grade, you're about 11 years old. So it's kind of early, although when I was in medical school, I delivered a baby from a woman / girl who was 14, turned 14, and she delivered a baby. So maybe 11 for some people, 12 for some people. Take the class anytime you think is important.
Well, I think people are developing earlier.
I think so. You're right.
Today, a 10-year-old girl can be having her period, and and Justin is helping us here. He said through hormones, which that's absolutely correct.
I know there's some literature that suggests it's the food. Yeah. The food, the milk and the meat products because the animals are. Justin, you got to admit.
Well, it's the hormones that we're putting in our that we're feeding our our cows and all of our meat products, right? That are getting our food, and now puberty is starting much younger than I'm sure it did 50 or 100 or 200 years ago, things like that.
Or even 20 years ago, or yes,
right.
Absolutely. You're so right. And so what are we doing to our food? What are we doing to our children? But, we need to arm them with good information. And actually, children are sexual all the time. They're sexual when they're 5 years old.
Yeah, even as up to 1 year old, they start stimulating themselves.
Yes.
Yeah.
And I
which is good.
I've had people to call me and say, this child must have been sexually abused because they're touching themselves. And no, they're touching themselves because it feels good. That's what they like. And so, if you find your child at 3, 4, any age, touching themselves, giving themselves pleasure, please do not shame them. Just explain to them that, I know that feels good, but, you might want to go in your room or go here and be a little more private. At grandma's dinner party, you might not want to do that. But teach them that their body is for pleasure, and it is a good thing. There is nothing to be ashamed of. In fact, little boys in the womb have, before they're born, have erections.
Wow, I didn't know that. That's crazy.
That's crazy.
Yeah.
Those little boys get going early.
It's interesting talking about touching yourselves, and I remember going on the rounds one time at a state hospital, some kind of county hospital, state hospital, some institution, and they would write in the notes of what Bob did or Mary did that day. They would write by hand what all things they did. And one thing they would always put in there is that Bobby, let's say, has been digging at himself. Digging meaning, masturbating or something like that. And I think, well, what difference does it make? As long as they feel good, they're happy, and they're happier than when they came.
Exactly. I just think it's some people's discomfort with that. And, then if we shame our children, they're going to have shameful feelings about sexuality, which, gets them off on the wrong place. And I know people have heard things before and they have different beliefs, but please listen to us and don't shame your children. In fact, encourage them to be private and respectful. Everything is a teaching moment.
I think it'd be interesting to find out everybody who got it annulled in LA County, the marriage annulled, which is something you can do up to 6 months, and have them do a questionnaire and say, well, why? Was it bad sex, or you didn't know the person, or I snore, whatever it is. It'd be interesting to find out why people leave a relationship after less than 6 months.
Because they don't know each other.
Right.
It's just that cathexis that they...
The cathexis wasn't working.
...jump into, or a reason like this person is going to give me the life I want. I don't have it. And, this person is going to make me whole. That thing, you complete me? Mm-hmm. I hate that. Mm-hmm. Oh, I hate that, because you need to be complete before you get into a relationship.
We should talk to people on The Bachelor show.
On The Bachelor show?
The Bachelorette, I meant. Bachelorette, yeah.
I think we should. I think we should be on the show. What do you think?
I don't think I'd feel comfortable with that.
And talk to, and it would just say, and okay, now what do the doctors think about this scene? Mm-hmm. That would be fun. That
would be fun.
Yeah.
Because I brought that up because I think the winner of The Bachelorette wrote some little poem to the lady that said something like that, that you complete me and we're going to have our whole life together.
Doc, you are a romantic. You're watching he is wow, here this scientist who's always been the physician.
Well, I did read MSN this morning, and that's what it's reported as. Yeah. But I did joke with somebody. We're going to go out of this section in a second. But I did joke with a woman recently. Said, "Oh, you can't go that day. That's the finalist for Bachelorette." He goes, "Oh, I forgot. Oh, I'm so excited." And I'm thinking, I am so opposite. But anyway, this is Dr. Gregory Jenkins with Dr. Judith Curts, and we're going to close down this segment, and our phone number, if you need to talk to us, is 298-5487, and we'll be right back for this final segment. Thank you.
Hi, and we are back. This is Dr. Judith Curts, and I'm with Dr. Greg Jenkins, and we have been talking about romance and the sexual response today, and how it all works, how we're different and how we're alike. So, how do we have so many problems? It sounds very, very simple, but why should there be a sex therapist? Why should there be a physician? I mean, people really have so many issues when it comes to sexuality, and for me, many times it comes back to communication, and couples are so uncomfortable talking to each other about sexuality. I wish that they could do that more and never talk to each other about sexuality or any sexual issue when you're ready to be sexual. Be driving in the car, go for a walk in the park and talk about it where you've got your clothes on and it's a lot more comfortable. What do you think about that?
I think that's good. I think the other thing I forgot to bring up, to go back a little bit on the physiological thing, is that there's part of our body is called the autonomic, almost sounds like automatic, but it's autonomic nervous system, and that's the part of the nerves that we cannot control. So if we go out into the lighted area, our pupils become pinpoint. When we go in the dark area, they open up. Same with, you can feel your hair moving, or you can feel cold air, or you can feel pinpricks. You can't control that. You can't stop it. When you go to the doctor's office and they tap on your knee and it jerks up, you can't control that. So same thing happens with lovemaking here, is that there's certain things you can't control. If you become aroused, the list of things I told you about happens automatically, and you don't think about it. Okay, I'm going to turn the switch now and go to the next thing. I'm going to turn the switch and go to the next thing. It doesn't happen that way. It just all runs together, and that is the autonomic nervous system. So it's interesting to
see. You have a big word too.
I think autonomic's a common word in
No, it
my
isn't.
business.
See, just see, that's the
I had a cathexis about it.
Autonomic. I'm going to remember that one
So
too.
when you feel the air conditioner blow across your skin, that is autonomic. You can feel you can feel the hair kind of moving on your arm, or you feel the cold on your air. So those things you can't control. The same thing about relationships and arousal here. You can't control it. So it's important to find out what turns on the autonomic system for you.
Yes, and you need to know that. You're right, for you, plus your partner, but for you too. I mean, I think that's so important. Know what turns you on, know what you like, talk about it, and you're going to have a much, much better relationship.
What about when you say, we're going to have sex, and one person says, well, what do you want to do? And the other person says, I want to do what you want me to do. Is that a good, healthy thing?
It can be. It can be. Somebody just might want to be submissive and saying,
That's a whole nother show.
That's another show. Oh, but there's so much to talk about that.
I think Dr. Curts here is the expert in that, probably.
I am.
She came here from Florida.
Some people do want to be submissive, so, honey, anything you want to do, I'm there. Within reason. You've got to have the boundaries or the safe words. But I think you should have, if somebody says, we're going to be sexual, and what are we going to do? How are we going to do this differently? Well, I was thinking about this last time, and let's try this. Or
the variations in positions you're speaking of, is that right?
Variations in positions, in toys, if you want to use toys, if you want to be touched a different way, like, oh, that really felt good last time, I'd like to keep doing that. Yeah, all different things. And that's, so many couples complain about, there's no more excitement in the relationship. There's just, it's over, there's no excitement. You can kind of bring the excitement back many times just by changing some things.
So variation. So, okay, well, we'll work on that.
We'll work on that. Well, and, there's the woman on top, or they call it the missionary position. It's, and then the universal position is from the back. So that's universal, or doggy, whatever. But that is the most common around the world. But those missionaries got in the way and said, no, you have to look at each other. We have to have.
That's why that came about. You're right.
Yes. So
You want to show the love, yeah.
and there isn't a correct position. It's what feels good to you, and bodies are different. So it's what feels good to your body. Share
Well,
that.
I think that's good. I think we're going to wrap this up today.
Aw.
I know it's almost done here, but we're going to be signing off, and we're looking forward to hearing back from you on the email, or you can call us at 298-5487. And we're coming back next week with a woman who has the supplement store, and she's also a personal trainer. So this is Dr. Gregory Jenkins with
And
Dr.
Dr.
Judith
Judith
Curts, and we're signing off. Thank you very much.